Today I want to talk about 3 blood pressure medications that millions of seniors take every single day, often without ever being told the full story about what they do, what they can quietly cause, and what matters most once you are no longer 40, 50, or even 60, but well into the years when balance, kidney function, hydration, and medication sensitivity begin to change. The names on the bottles may say Amlodipine, Losartan, or Lisinopril. Maybe you have been taking one of them for years. Maybe 2 of them are part of your morning routine. Maybe your doctor started one recently after a high reading at an office visit, a hospital stay, or a warning that your blood pressure had been creeping up for too long. And like so many people, you may think of them simply as blood pressure pills. You take them, the numbers look better, the prescription gets refilled, life moves on. But here is what most seniors still do not know. These 3 medications do not work the same way. They do not create the same side effects. They do not carry the same hidden risks. And the older you get, the more those differences matter. What I want to do today is walk you through what each of these medications actually does inside your body. What side effects deserve real attention? What combinations are common? What combinations are usually avoided? And the practical warning signs every older adult should know before the next dizzy spell, swollen ankle, dry cough, or abnormal lab result catches them off guard. By the end of this conversation, you will understand these medications better than most patients ever do, and you will know exactly what to bring up at your next medical visit. I'm your doctor, and this is Wellness Daily. Stay with me, because this is one of those conversations that can change how safely you take care of yourself. Let me start with the most important point before anything else. I am not telling you to stop taking your blood pressure medication. Uncontrolled blood pressure is dangerous, especially in older adults. It raises the risk of stroke, heart attack, heart failure, kidney damage, vision loss, and even certain forms of cognitive decline. These medications are prescribed because they can reduce those risks in meaningful ways. For many people, they are not optional. They are protective. What I am telling you is something different. I am telling you that seniors often get prescribed these medications without a full explanation of what to watch for, how these drugs differ, and what subtle side effects can slowly affect quality of life, stability, hydration, and kidney function long before anyone connects the dots. And that lack of understanding is where problems begin. So let us walk through them one at a time. Let me start with amlodipine. Amlodipine belongs to a class of medications called calcium channel blockers. What it does is relax and widen blood vessels. When those blood vessels relax, the pressure inside them comes down, and your heart does not have to pump against as much resistance. That is why amlodipine is so commonly used. It is simple, it is usually taken once a day, it works steadily over 24 hours, and for many older adults, it lowers blood pressure effectively without causing the dry cough that some other blood pressure medications can cause. That all sounds good, and in many cases it is. But here is what many seniors are never told clearly about amlodipine. The most common issue is swelling, especially in the ankles, feet, and lower legs. This is one of the most overlooked medication side effects in older adults. People notice their socks leaving deeper marks, their shoes feel tighter by evening, their ankles look puffy, and instead of asking whether the medication could be the cause, they assume it is just age, poor circulation, the weather, or standing too long. But amlodipine is a very common reason for leg and ankle swelling, and I want to be clear about something important. That swelling does not automatically mean your heart is failing. It does not automatically mean your kidneys are shutting down. Sometimes it is the medication itself. Now, of course, swelling should always be taken seriously, because swelling can also come from heart, kidney, or vein problems. But if you started amlodipine and then developed swelling, or if the swelling got worse after the dose was increased, that is a conversation worth having with your doctor. Sometimes lowering the dose helps. Sometimes switching medications helps. Sometimes a doctor pairs it thoughtfully with another medication. The point is this: do not quietly live with worsening swelling for months or years without mentioning it. The second thing seniors should know about amlodipine is dizziness. Not everyone gets it, but when it happens, it matters. Because in older adults, a brief dizzy spell is not a small inconvenience. It can be the beginning of a fall, and a fall at 72, 78, or 84 is not the same as a stumble at 32. You may stand up from bed. You may rise from the couch. You may get out of a chair too quickly. For a second or two, the room feels off. You steady yourself. You tell yourself you are fine. That moment is easy to ignore, but sometimes those little moments are the warning signs. Amlodipine can also cause headaches, flushing, fatigue, and a feeling that your heartbeat is more noticeable. Some people feel warm in the face. Some feel heavy-legged. Some feel more tired than they expect. These effects are often mild, but they matter if they change how steady, active, or comfortable you feel. There is another practical point many people miss. If you are on amlodipine, alcohol can make low blood pressure symptoms worse. Hot showers can make them worse. Dehydration can make them worse. And in seniors, those things can stack up quickly. Now let us move to Losartan. Losartan is in a completely different class. It is called an ARB, which stands for angiotensin receptor blocker. That means it works on a hormone system in the body that affects how tightly blood vessels squeeze and how the kidneys handle salt and fluid. In simple terms, Losartan helps blood vessels relax and can also help protect the kidneys in certain people, especially those with diabetes. That is one reason doctors like it. It often lowers blood pressure well. It usually does not cause the dry cough that lisinopril can cause. And for many patients it is well tolerated. But Losartan has its own set of things seniors need to know. The first is this: Losartan can affect kidney function and potassium levels. Now let me explain why that matters. As we get older, kidney function often changes gradually, even in people who feel completely fine. Add in dehydration, illness, diabetes, other medications, or reduced fluid intake, and the kidneys become even more sensitive. Losartan can be very helpful, but it is one of those medications that should not just be prescribed and forgotten. It needs monitoring. Blood pressure should be checked. Kidney function should be checked. Potassium should be checked. Why potassium? Because potassium that gets too high can affect the heart rhythm. It does not always cause obvious symptoms first. Sometimes people feel weak. Sometimes they feel off. Sometimes there are no warning symptoms at all until a blood test catches it. And here is one of the quiet mistakes seniors make without realizing it. They switch to a salt substitute because they are trying to be healthier, but many salt substitutes contain potassium. So now you have a person taking Losartan, maybe also with reduced kidney function, maybe also on another medication that affects potassium, and then on top of that, they start using potassium-based salt substitutes every day. That can become a problem. This does not mean everyone on Losartan has to fear food. It does not mean you need to panic about a banana or a tomato. It means you should know that potassium matters, and if your doctor has told you to watch potassium, that advice is not casual. It is important. The second thing to know about Losartan is that it can make dizziness and lightheadedness worse, especially when you first start it, when the dose is raised, or when you are dehydrated. And dehydration in older adults happens more easily than many realize. A stomach virus, diarrhea, vomiting, a hot day, poor appetite, not drinking enough, sweating more than usual, taking a water pill, all of that can push blood pressure lower and stress the kidneys at the same time. That is why one of the most important questions a senior can ask is not just, what do I take every day? But also, what should I do if I get sick and can't keep fluids down? That is an excellent question for your doctor, because in some cases, medications like Losartan may need temporary review during significant dehydration or acute illness. Not because the medication is bad, but because the situation has changed. Now let us talk about Lisinopril. Lisinopril is an ACE inhibitor. It also works on the same general hormone system that affects blood vessel tightening and blood pressure, but it does so in a different way than Losartan. Lisinopril is widely prescribed. It can be very effective. It is often used for blood pressure, heart failure, and after certain heart problems. It is inexpensive, familiar to doctors, and beneficial for many patients. But lisinopril has one side effect that is so classic, so common, and still so often misunderstood that it deserves special attention. The dry cough. If you are taking lisinopril and you have developed a persistent dry cough that does not feel like a cold, does not bring up mucus, and seems to linger for weeks or months, the medication may be the reason. This is one of the most common reasons people end up being switched from lisinopril to Losartan or another ARB. And yet many seniors go through chest x-rays, cough syrups, inhalers, allergy treatments, and a dozen theories before anyone steps back and says, maybe it is the lisinopril. If you are on lisinopril and have a chronic dry cough, do not ignore it. Now there is another side effect of lisinopril that is less common but more serious, and every senior should know it. Swelling of the lips, tongue, face, or throat. This is called angioedema, and while it is uncommon, it can be dangerous. If swelling affects breathing or swallowing, that is urgent medical care. Lisinopril, like Losartan, can also affect kidney function and potassium. It can cause dizziness. It can make blood pressure drop too much in the wrong circumstances. And just like Losartan, dehydration can make those risks more significant. So here is one of the most important things most seniors are never told plainly. Losartan and lisinopril are not usually meant to be taken together. Amlodipine may be paired with Losartan. Amlodipine may be paired with lisinopril. Those are common combinations because they work through different pathways. But Losartan and lisinopril both work on related blood pressure hormone systems, and for most people, using both together is usually avoided because it can increase the risk of kidney problems, low blood pressure, and high potassium without giving the kind of extra benefit people imagine. That is a major point of confusion for many patients. They think, if one blood pressure pill helps, two that work on the same system must help even more. Usually that is not how this works. And now we come to what may be the most important hidden issue for seniors taking any of these medications, but especially when combinations are involved. The risk of feeling fine while sitting down and unsteady the moment you stand up. This is where many stories begin. You get out of bed, you feel just a little lightheaded. You walk to the bathroom. You catch yourself on the wall. You do not fall, so you dismiss it. You stand up from the dinner table and need a second before you can walk normally. You shrug it off. You step out of a hot shower and suddenly feel weak. You bend down to pick something up, stand back up, and the room shifts for a moment. These are not always dramatic symptoms. That is exactly why they are dangerous, because in older adults, the body does not always recover from falls the way it once did. A broken wrist, a hip fracture, a head injury, a hospital stay, days in bed, loss of confidence, reduced mobility, more dependence, more fear, and suddenly life is different. This is why I tell seniors that preventing falls is not a side issue in blood pressure care. It is central to blood pressure care. If your medication is lowering the numbers beautifully but making you unstable, that matters. So what should you do? Stand up slowly. Sit at the edge of the bed for a moment before rising. Pause after standing. Hold on to something stable if you need to. Be especially careful first thing in the morning. Stay hydrated unless your doctor has specifically restricted your fluids. Be cautious after hot showers. Limit alcohol, because alcohol can worsen low blood pressure symptoms. And if you have had near falls, real falls, or recurrent dizziness when standing, tell your doctor. Do not wait for it to become a crisis. Now let me walk you through the specific things I want seniors to monitor if they take amlodipine, Losartan, or lisinopril. First, know which medication you are actually taking. You would be surprised how many people know they take a little white pill for pressure, but do not know whether it is amlodipine, Losartan, or lisinopril. That matters because the side effects are different. Second, check blood pressure at home if you can, not obsessively, not every 20 minutes, but regularly enough to understand your pattern. A home blood pressure monitor is one of the most useful tools a senior can have. Check it seated, rested, and ideally at similar times of day. Keep a log. Bring that information to your appointments. Third, pay attention to symptoms, not just numbers. A blood pressure reading can look perfect on paper, while the person attached to that reading feels weak, dizzy, swollen, or unwell. Your experience matters. Fourth, have lab work done when your doctor recommends it. This is especially important for Losartan and Lisinopril because kidney function and potassium need monitoring. If a medication affects the kidneys or electrolytes, you do not want to find out there is a problem only after symptoms become severe. Fifth, mention every over-the-counter medication and supplement you take. This is another place where seniors get into trouble without realizing it. Ibuprofen and naproxen matter. Potassium supplements matter. Salt substitutes matter. Herbal products matter. Even something as simple as adding a new over-the-counter pain reliever regularly can change how safe a blood pressure medication is for you. Sixth, do not stop these medications abruptly without medical guidance. If you think a medication is causing a problem, that deserves a conversation. It does not deserve silence, and it does not deserve sudden self-discontinuation without a plan. Now let me speak directly to a few groups of people who need to listen especially closely. If you are a senior with diabetes, these conversations matter more because kidney protection and kidney stress are both part of the picture. If you are a senior who has ever fainted, almost fainted, or fallen, these conversations matter more. If you live alone, these conversations matter more. If you take several medications, these conversations matter more. If you have swelling you have been ignoring, a cough no one has explained, or dizziness you have normalized, these conversations matter more. I also want to say something that many people need to hear. Just because a side effect develops slowly does not mean it is harmless. The ankle swelling that gradually became your new normal, the dry cough you learned to live with, the fatigue you blamed on age, the lightheadedness you brushed aside. These things deserve review. Not panic, not fear. Review. Because sometimes the difference between struggling and feeling better is not a brand new diagnosis. Sometimes it is simply recognizing that the medication plan needs a second look. And yet I do not want you leaving this conversation afraid of these medications. That is not the point. The point is informed partnership. Amlodipine can be an excellent medication for the right patient. Losartan can be an excellent medication for the right patient. Lisinopril can be an excellent medication for the right patient. Used thoughtfully, these medications help protect the heart, brain, blood vessels, and kidneys. They prevent terrible outcomes. They save lives. They help people live longer and better. But they work best when the person taking them understands what they are watching for. That is where you come in. You are not just swallowing a pill. You are observing your body. You are noticing patterns. You are watching for swelling, cough, dizziness, weakness, and blood pressure changes. You are asking questions. You are bringing up concerns. You are making sure the medication is serving you, not just the number on a chart. That is how good blood pressure care actually works in real life. Before I let you go, let me leave you with a simple list of questions every senior taking amlodipine, Losartan, or Lisinopril should be ready to ask. Is this medication still the best fit for me now? Could this swelling be from amlodipine? Could this dry cough be from Lisinopril? When were my kidney function and potassium checked last? What should I do if I get dehydrated from vomiting, diarrhea, or illness? Is my dizziness a sign that my blood pressure is going too low? Should I be using this salt substitute? Am I taking any over-the-counter medicines that could interact badly with this prescription? And if you can answer those questions, or at least bring them to your next appointment, you are already doing something many patients never do. You are becoming an informed partner in your own care. That matters more than most people realize, because the goal is not just lower blood pressure. The goal is lower blood pressure without unnecessary suffering, without avoidable falls, without preventable kidney trouble, and without years of side effects that no one ever took the time to explain. So if you take amlodipine, Losartan, or Lisinopril, let this be the moment you stop treating that bottle like a mystery. Look at the name. Know what it does. Know what it can cause. Know what your body has been trying to tell you. And most of all, bring those observations to the people caring for you. The right conversation at the right time can prevent a lot of harm. Everything I have shared today is for education, To help you understand some of the most commonly prescribed blood pressure medications in older adults, and to help you know what to discuss with your doctor or pharmacist. Every patient is different. The right plan for you depends on your full medical history, your kidney function, your other medications, and many other factors that only your own clinician can evaluate. Please do not stop, change, or combine medications on your own based on this conversation. If you develop severe dizziness, fainting, chest pain, trouble breathing, swelling of the lips or tongue, signs of stroke, or any sudden serious symptoms, seek medical care right away. Take care of yourself, take your medications thoughtfully, and I will see you next time on Wellness Daily.